Welcome to Season 1, Episode 12 of the Home Healthcare Today Show. I am your host, Dr. Cleamon Moorer. It's July. In the month of July, we have the pleasure of focusing on a very important topic, and that topic is healthy vision. On our show today, we have Dr. Joel L. Pelavin. Dr. Pelavin is a board-certified comprehensive ophthalmologist with over 30 years of experience in the practice of ophthalmology. He received his undergraduate degree from Michigan State University and Doctor of Medicine degree from the Wayne State University School of Medicine. He completed his ophthalmology residency at the prestigious Kresge Eye Institute of Wayne State University. Throughout his career, Dr. Pelavin has instructed medical students and residents in the area of ophthalmology and was awarded Teacher of the Year by the residents of Beaumont Hospital. Dr. Pelavin has presented and published on the treatment of glaucoma, intraocular surgery, and ocular injuries. His practice focuses on sutureless small incision cataract and intraocular lens implantation surgery. He has additional expertise in laser eye surgery and in the treatment of glaucoma and macular degeneration. Dr. Joel Pelavin currently practices at Eastside Eyecare Physicians Group. Dr. Pelavin, welcome to our show today.
Thanks for having me, Clint.
So, Doctor, as we discuss this very important topic of healthy eyes and healthy vision, how about you tell us a little bit more about yourself, a little bit about Eastside Eyecare Physicians, where you practice, your expertise, and then maybe even a little bit about your passion for ophthalmology.
Well, to start with, as you said, I graduated in 1979 from Wayne State University School of Medicine.
Yes.
And after my graduation, I spent a year at Henry Ford Hospital in a general medical internship, after which I did a 3-year residency at the Kresge Eye Institute at Wayne State University.
Yes, sir.
Following my completion of the residency, I purchased a practice from a retiring ophthalmology in St. Clair Shores.
Okay.
And I was in solo practice for 34 years in St. Clair Shores. In 2017, I joined a small group of 3 fellow ophthalmologists at the Eastside Eye Physicians. And I've been there since 2017. During my career, I've always enjoyed teaching. And so during much of my career, I've taught medical students, ophthalmology residents, and family practice residents in ophthalmology. And one of my proudest accomplishments was being awarded Teacher of the Year by the Beaumont Family Practice residents.
Congratulations again on that designation.
I first became interested in ophthalmology after my first year of medical school, where I spent a summer at the Sinai Hospital Eye Clinic. And at that point, I was very impressed with the technology and instrumentation that was involved in eye care.
Yes.
As well as the breadth of the field as it related to other medical specialties, and the satisfaction that the doctors derived from helping people with serious eye problems.
Yes.
And that was my main motivation for going into ophthalmology.
Very good, Doctor. And as you mentioned the background, spending time at Henry Ford, and your trajectory on through acquiring an organization, and then in 2017 joining a smaller group. Doctor, as we think about eyes again, that's a very vast array of experiences within your journey of graduating in 1979 and still practicing and seeing patients today. What were some of the challenges, Joel, along the way as you decided to, pursue your education and then practice?
Well, when I graduated from the Kresge Eye Institute, I felt that I was well prepared from a medical knowledge and skills standpoint.
Yes.
But I realized that I was ill prepared in terms of running a business.
Yes.
And I think even nowadays, medical school graduates and residency graduates haven't been prepared for the modern environment of practicing medicine. Okay. I fortunately had the luck to marry someone who had quite a bit of background in accounting, banking, financing, marketing, and she was able to help me secure the financing for the practice, arrange contracts with vendors and insurances, and in many more of the administrative aspects of running a medical practice.
Absolutely. Yes, sir. Very good, Joel. So, Joel, as we round it and bring it forward, you mentioned, and I appreciate mentioning how there are medical school students that are ill-prepared to run a practice, right? Because there is obviously that business side. So our interview is sort of focused on that practitioner side, but as we shift now to more of the patients, right? The patient side of the house, where eye health, for a child or an adolescent, is a little bit perhaps different than for an adult or an aging adult, right? A kid needing glasses whenever they go to preschool or kindergarten, or being teased, right? And being called four eyes and the like, right? Let's talk a little bit about that. How does the Eastside Eyecare Physicians Group take care of, youth, kids, perhaps young adults, and some aging adults?
I would say the majority of the patients that we see are older adults. Okay. And just logically, a lot of problems that occur with the eyes are the consequence of living longer.
Okay.
But we do see children. We see children with eye muscle imbalances, children with vision abnormalities. And one of the issues with children is that they don't often complain of vision loss, particularly if it's vision loss in one eye. Yes. A child may have amblyopia, which means lazy eye.
Yes.
And they're not aware of it, unless it's brought to their attention by a school screening or by seeing a physician.
Yes.
So that is often the route for which we see these patients.
Absolutely. Yeah. So, doctor, with that being said, obviously 20/20 vision is quote unquote perfect, right? For that child that has a lazy eye, right, or a person that has poor eyesight, 20/40, 20/60, 20/80 becomes their quote unquote reality. What have you seen, doctor, throughout the years to help individuals that have poor eyesight get better eyesight?
Let's say, first of all, that 20/20 is not necessarily perfect eyesight, but it's normal vision.
Yes.
Just for a perspective, in order to get a unrestricted driver's license in the state of Michigan, you have to be able to read 20/40 without glasses.
Okay.
If your vision is 20/50 or less, you may have trouble renewing your driver's license.
Yes. Gotcha. Okay.
Or you may have a restricted driver's license, such that you can only drive during daytime conditions.
Yes. Awesome. Yes, doctor. And this topic is a little personal for me. Granted that I was born with cataracts, I had congenital cataracts, and they sort of progressed throughout my teenage years to the point of age 21 or so. I was considered legally blind, if you will, right? So did have the procedure to have them removed, right, the lenses, and had the artificial implants back in '97, doctor. So a lot of development since then in terms of the technology.
Well, in fact, We do see children with congenital cataracts.
Yes.
And sometimes they can result in this condition, amblyopia, if they're not treated at an early age.
Yes.
And cataract surgery can be done in infants, can be done successfully in infants.
Wow.
Lens implants can even be placed in infants' eyes, or contact lenses. The problem is that when you remove a cataract,
Yes.
which is clouding and discoloration of the natural lens of the eye,
Yes.
you're losing about a third of the focusing power of the eye. And you may recall seeing patients years ago with thick Coke bottle glasses.
Absolutely. Yes, sir.
Through which they could see and they could read, but it was cumbersome. The vision was magnified,
Yes.
and the field of vision was constricted, so it was by no means a perfect solution.
Absolutely.
The field of intraocular lens implant surgery has progressed over the last 70 years to the point that high-quality lens implants can be placed in the eye to restore the normal focusing power
Yes.
and actually mimic the eye of a 20-year-old, for example. So that's been a major boon to the field of ophthalmology.
Absolutely. Dr. Pelavin, we're going to go to a commercial, and when we get back, we're going to talk more about some of those major advances to help individuals that have poor eyesight have better eyesight. So headed to a commercial. As Americans, we're defined by our grit, our toughness, our excellence, and our multiculturalism. But here in Detroit and Southeast Michigan, we are battle tested. That's our advantage. We've been hit rather hard by the pandemic and other health challenges. Allow American Advantage Home Care to provide skilled home care services for you in the comfort of your own home. We are Joint Commission accredited and CMS certified. Call us today. Welcome back to Season 1, Episode 12 of the Home Health Care Today show. I'm joined here by our very special guest, Dr. Joe Pelavin, as we discuss ophthalmology and Healthy Vision Month, granted that it is still July. Dr. Pelavin, as you alluded to prior to our commercial about the evolution of ophthalmology and research and development over the, I think you gave like a 70-year time frame there in terms of advances in intraocular procedures and developments. What would you say have been like those ground-breaking or the big advances over the last couple of decades?
Well, there's a condition that we see in older adults called macular degeneration.
Yes.
And it becomes more prevalent as people get older. It's been said that patients in their 70s and 80s, 1 in 4 of them can have severe macular degeneration or even higher. And it's extremely disabling because it's where the central vision deteriorates.
Yes.
The vision that you use to read, recognize faces,
Yes.
drive.
Yes.
It's not like the lights go out entirely.
Right.
But when you can't function to read, when you can't read particularly,
Yes.
it's very disabling.
Yes.
So prior to, say, 15 or 20 years ago, if you had macular degeneration, you were destined to go blind. You were destined to lose your central vision.
Yes.
At some point in the early 2000s, they developed medications that could actually be injected into the eye to retard the macular degeneration. In some cases, to restore the vision.
Wow. Okay.
And that has been revolutionary.
Yes.
It's changed the face of the practice of ophthalmology.
Absolutely.
And these injections sound, intimidating.
Sure.
But I have to say, in my experience, they're not that bad. The eye is anesthetized. It's a tiny needle. It's a tiny volume of medication.
Yes.
And the patients, most of the time, hardly are aware that it was done.
Wow. Yes, doctor. So in an attempt to reverse that macular degeneration through the use of that medication and through procedures such as that, how quickly is the improvement in vision realized for patients. So this is exciting.
They may realize, they may be aware of a significant improvement within weeks to a month.
Wow.
The
Awesome.
problem that we see is that the medications wear off,
Yes.
and the injections have to be repeatedly given over a period of time.
Okay.
And there can be tremendous expense to that.
Yes.
Some of the medications are not covered by insurance.
Gotcha.
Patients oftentimes have a high copay.
Yes. Okay.
So there's a large financial constraint on
Absolutely.
the delivery of this care.
Okay, doctor. So, in view of preventative maintenance of the eye or preservation of vision, what are some things that you suggest for listeners and viewers in Southeast Michigan to, hone in on a healthy vision or healthy lifestyle that's related to eye care?
So the eye has a lot of similarities to the cardiovascular system. The eye is a very vascular organ. Depends on high blood supply to replenish molecules,
Yes.
to process vision, and things that are good for your cardiovascular system
Yes.
are very good for the eyes.
Mm-hmm.
So, for example, exercise,
Yes.
very important for the eyes. Healthy diet,
Yes.
very important for the eyes. Vitamin supplements, in some cases,
Okay.
can be helpful, especially for patients with macular degeneration.
Mm-hmm. Yes, sir. Okay. Good stuff, doctor. Good
Ocular
stuff.
hygiene
Yes.
is something that's quite neglected.
Okay.
Patients, while they may scrub their face and their hands and their body, oftentimes avoid cleaning around the eyes. And we'll see various inflammatory and infectious conditions affecting the eyelids
Yes.
and outer surface of the eye.
Absolutely.
So a lot of my time is spent counseling patients on proper eyelid hygiene.
Yes. Absolutely. Yes. And the sty, right? The
Styes,
styes. Yes.
blepharitis, rosacea are things that we commonly see causing not necessarily vision-threatening problems,
Yes.
but nuisances or annoyances, or sometimes serious infections.
Absolutely. So, doctor, over the last 30 years or so of being in the practice of ophthalmology, and this one's a little off the script, but it's fair, as related to ocular hygiene. I'm sure there's a lot of products that you've seen that have been presented to you for patients in terms of eye cleaning, eye wash, eye drops, right? Even contact solutions, right? As related to individuals and what they could buy over the counter. Not that I'm asking for an endorsement of any product or another, but are there some pretty good resources for individuals to purchase to help them with their ocular hygiene?
Well, you can start from the least expensive,
Yes.
which is simply hot water and a washcloth
Yes, sir.
cleansing around the eyelids.
Absolutely.
There are prepackaged pads, similar to like handy wipes you get in restaurants,
Yes.
that are made for the eyes that can be purchased.
Very good.
There are solutions that you can use in the shower to
Yes.
cleanse and massage your eyelids.
Awesome.
Some people tout using baby shampoo on their eyelids.
Yep. Tear-free. Yes.
There are expensive preparations as well.
Awesome.
I tend to recommend a particular brand called OcuSoft
Okay.
wipes and foam
Yes,
for the
sir.
eyelids. But really, if a person simply takes the minute or two to cleanse and massage the eyes with a washcloth in their shower or their bathroom
Yes.
when they're freshening up in the morning, that in itself goes a long way to preventing styes and ocular surface disease.
Wow. Very good. Very helpful information, Dr. Pelavin. Joel, in view of our organization, American Advantage Home Care, we happen to take care of several homebound patients who have, eye issues or eye problems, but they tend to be comorbidities of other illnesses or ailments. Are there any comorbidities that come to mind for you that listeners and viewers should be aware of, and also focus not only on that particular health ailment or issue, but also focus on their eye health as related or as connected to that primary illness?
Well, the main comorbidity that comes to my mind is diabetes.
Yes.
Because diabetes can cause damage to the retina, can cause blindness.
Yes.
And those patients, and the diabetes can affect the eyes in ways that a patient is unaware of.
Yes.
Until they have a bleed in the eye and sudden vision loss. So it's important for those patients to be screened
Yes.
at least periodically.
Absolutely.
A dilated eye exam.
Okay.
There are visiting physicians, ophthalmologists,
Yes.
that can attend people at their homes and
Yes.
do a dilated eye exam as a branch of the visiting physicians organization.
Yes.
Or those patients can be accommodated in the ophthalmology office.
Yes.
So just because they have these comorbidities, it's more of a reason for them to have their eyes examined than I understand it's a barrier,
Yes.
but it's even more of a reason for them to receive the screening and the care that they deserve.
Yes, sir. And with those visiting doctors that, go out and visit the patient at home and can, perform screenings and the like, that is so helpful for a lot of our listeners and viewers. As related to homebound status for those folks that aren't able to get out, knowing that they could have a visiting physician is excellent. Do you recommend home health care for patients who have debilitating, eye issues or eye disorders?
I think it's a wonderful thing, particularly when you take into consideration that if a patient has a vision problem, it may be more difficult for them to self-administer their medications.
Yes.
For a diabetic to give themselves insulin, for example,
Yes.
can be very challenging. So the ability to have assistance in that respect is oftentimes the difference between staying at home and
Yes.
being in a nursing facility.
Absolutely. Absolutely, doctor. We'll circle back because I do want to make sure that Eastside Eyecare physicians, in the event that you all are accepting new clients or accepting, patients, referrals, that we get a good contact number for your group. And then we want to talk, Joel, about some of the milestones since you joined the group in 2017. What are some of the great things that you feel as though you've been able to add and contribute to the group?
Well, for one thing, I had a respectable patient clientele that I was able to bring to the practice.
Very good.
Yes. From a revenue standpoint.
Absolutely.
And I'm pleased to say that the majority of my patients followed me to the two offices where I see patients now.
Good.
I like to think that my 30-plus years of experience,
Yes.
garnered some wisdom that I can bring, wisdom and judgment
Absolutely.
that I can bring to the group as well.
Yes, sir.
And it's made my life easier from the standpoint that I'm not burdened by a lot of administrative functions that detract from patient care.
Absolutely, sir. Very good, very good. Thank you, Joel. Last question as we wrap up here for our Southeast Michigan listeners and viewers. Are there any other resources, clinics, specialists, or groups that you would recommend for viewers here in Southeast Michigan?
So let's start with screening programs for people with low financial resources.
Yes.
Focus Hope conducts screening clinics, as does St. Christine's Community Services and the Capuchin Society. The various residency programs in the metropolitan area through Henry Ford and the Detroit Medical Center and Beaumont Hospital will see patients at reduced costs and work with them financially.
Yes.
And of course, there is, for people with more serious vision problems or impairments, there is the Greater Detroit Organization for the Blind.
Yes.
There is the Detroit Eye Institute. There is the Michigan Society for Eye Physicians and Surgeons that have a website and a phone number where they can direct patients, and I can, convey those to you afterwards.
Yes, sir. Dr. Pelavin, this has been wonderful. We'll be sure that the phone number is added to the screen, right, for our viewers, right? And on our website, we'll be sure to have the Eastside Eyecare Physicians contact information online as well for those podcast listeners. Dr. Joe Pelavin, thank you so much for joining us today and providing such great insight around a very important topic, which is eye health and healthy vision for the month of July. Thanks for joining us today, Joel.
Pleasure.
Thank you.